Imagine being woken up not by a sound, but by the weight of 400 pounds of predator collapsing your tent onto your face. You're trapped in a synthetic cocoon. Your left arm is already being crushed, and you have less than 2 seconds to find a trigger you can't even see. This is the story of the Pogo Mine tent breach. June 18th, 2018. The Pogo Mine site, Interior, Alaska. Alaskan summer does not produce true darkness. What exists at this hour is a persistent grayish twilight that flattens depth perception and mutes color contrast. Air temperature holds at 62 degrees Fahrenheit. The sensory baseline of the camp is isolation and low-frequency industrial hum. Inside the tent, activity is zero. The victim is in deep sleep, encased in a synthetic sleeping bag rated for sub-freezing temperatures. That fabric, effective thermal protection under normal conditions, is about to become a physical constraint, limiting his range of motion at the worst possible moment. The tent is positioned on a gravel pad. Gravel provides no acoustic dampening for an approaching animal. The victim hears nothing until impact. To see why there was no warning interval, we have to look at the bear's behavioral state and the camp's layout. The black bear does not engage in a territorial display. No vocalization, no bluff, no investigative circling. It transitions from approach to predatory strike in seconds. A behavioral signature of a committed hunt. It moves toward the tent in a low, weight-forward gait, using its mass to collapse the nylon wall rather than tear through it. The angle of impact is approximately 45 degrees. The bear lunges through the side panel, pinning the victim's lower torso through the sleeping bag and tent floor. The surface beneath is cold gravel. No give, no cushion against the force transfer. The sleeping bag, now wrapped around the victim's legs, eliminates any rapid positional response. The bear's jaws clamp onto the victim's shoulder. Crushing pressure produces an immediate decrease in grip strength in the left arm, a direct physiological consequence of localized muscle and connective tissue trauma. Tunnel vision narrows his perceptual field. Fine motor control is degrading. The workspace available to him is a collapsed tent, a tangled sleeping bag, a gravel floor, and a bear driving its weight onto his torso. His right hand finds the .44 Magnum. It is there because he is wearing a chest holster, not stored in a boot, not in a pack, not under a pillow where the initial impact could have displaced it. It is physically attached to his body, and his body is exactly where the fight is. He does not attempt to create distance or establish a sight picture. He presses the muzzle directly against the bear's hide and fires one round. A contact shot at zero distance eliminates every variable that degrades terminal effectiveness. No air gap, no angled entry through fat and muscle. The full kinetic energy of the .44 Magnum transfers into the vital cavity. The bear dies instantly. The attack ends. Medical findings and aftermath. To understand how close this came to a different outcome, we looked to the clinical record. Immediate field treatment stabilized deep puncture wounds and lacerations to the upper torso and head. Clinical diagnosis confirmed significant crushing of the shoulder muscle and a near miss on arterial hemorrhage in the neck. The carotid architecture was intact, but the margin was narrow. The single contact round had bypassed thick hide and fat entirely due to zero distance placement, delivering full energy to the vital cavity. Recovery lasted several months, with physical therapy directed at restoring shoulder range of motion. Long-term physical limitations were minimal, statistically rare in predatory bear attacks, and directly attributable to the brevity of contact. The encounter ended within seconds of first impact. That timeline determined the difference between survivable tissue damage and a fatal outcome. The psychological record is consistent with documented tent breach survivor profiles: persistent sleep cycle disruption, hypervigilance during twilight hours, and a pronounced startle response to wind striking synthetic fabric.
The perceived safety of an enclosed shelter was permanently recalibrated. Incident analysis. There are no gear failures in this incident. The .44 Magnum functioned correctly. The chest holster performed exactly as designed under the conditions it exists to address. The single tactical gap was the absence of an early warning perimeter, a portable electric fence or tripwire alarm that might have moved the contact point outside the sleeping area before the breach occurred. Every variable in this encounter worked against the defender: darkness, confinement, sleeping bag restriction, grip strength loss, and 0 reaction time. The chest holster neutralized all of them by keeping the weapon within his available workspace, regardless of his position or the bear's movement. Practical takeaway. In bear country, your firearm must be on your body when you sleep. Not nearby, not accessible. On your body. The contact shot that ended this encounter was only possible because the gun was attached to the man, not stored somewhere near him. A tent is not shelter from a predator. It is a fabric bag that slows your reaction time. The weapon must survive the chaos of a breach, and the only carry method that guarantees that is one that moves when you move, stays when you're pinned, and puts the grip inside your available workspace when that workspace has collapsed to the dimensions of a sleeping bag.
The Pogo Mine survivor had one advantage most people overlook. He was alone, in a confined space, fighting a single variable. But what happens when your own hunting strategy is the thing that calls the bear in, and your primary weapon is designed for a fight that takes 2 seconds longer than you? To a human ear, an elk call is a tool for the hunt. To a grizzly, it's the sound of a free meal. That distinction matters more than most hunters realize. An elk call mimics a wounded, distressed, or territorial animal, broadcasting vulnerability at a frequency that carries through heavy timber for over a mile. Every predator within range processes that signal identically. Injured prey, close and locatable. The hunter using the call is not just attracting elk. He is advertising his position and his apparent weakness to every carnivore in the drainage. He is simultaneously stationary, camouflaged, and focused on a target species, meaning his situational awareness for threats approaching from other vectors is at its lowest point. This is the tactical environment Tom Sommer and his partner built around themselves on September 4th, 2018. The backcountry of the Gravelly Mountains, Montana. Air temperature sits at 44 degrees Fahrenheit. Early morning light filters through dense pine and fir, holding the forest floor in low, flat shadow. The sensory baseline is near total silence. No wind, no ambient noise beyond boots shifting on loose ground. Sommer and his partner are moving with deliberate stealth through a thick drainage corridor, clad in full camouflage. They are using elk calls, vocalizations mimicking a bugling or distressed bull. Something is already moving toward them. To see why the charge was unavoidable, we have to look at what the terrain and the hunter's own signals created. The drainage corridor restricts visibility to less than 15 yards. Archery encounter records show that in most cases, a bear is within 5 to 10 yards before the hunter identifies the threat. The grizzly does not pause at the crest of a small rise. It moves directly from first visual contact into a full charge. The bear gallops. It covers the 10-yard gap in under 1 second. The angle of impact is head-on. 500 pounds of moving mass strikes Sommer's partner before a bow can reach draw position. That sequencing is the controlling fact. A compound bow requires a minimum of 2 seconds to draw, anchor, and aim. The bear closes 10 yards in less than 1. The bow is not a weapon in this encounter. It is an object that has to be cleared before Sommer can reach the tool that can end the attack.
The hunters land on loose shale and pine needles. No traction, no resistance to being driven backward. The bear pins Sommer's partner. Sommer absorbs the adrenal dump of witnessing it from feet away. Heart rate spiking, fine motor control degrading, auditory field narrowing. He has to draw a handgun under these exact conditions while the mauling is in progress. He is carrying a Glock 20 in 10 millimeters. He moves to a flanking position, not retreating, but repositioning for an angle that puts rounds into the bear without risking his partner. He fires into the bear's midsection and shoulder. The bear disengages and retreats into the brush. It later dies from its wounds.
Medical findings and aftermath. To see what Sommer's intervention prevented, we looked to the trauma center record. Immediate field treatment focused on heavy pressure to deep lacerations on the scalp and neck. Clinical diagnosis at the trauma center confirmed extensive soft tissue damage and multiple puncture wounds from the bear's canine teeth. The medical assessment was unambiguous. Without the 10-millimeter intervention, the injuries would have progressed from survivable trauma to fatal predatory consumption. The handgun ended the encounter before that threshold was crossed. Recovery required multiple skin grafts and reconstructive surgery to the head and neck. Long-term physical limitations included localized nerve death and reduced range of motion in the upper cervical spine. No major arteries were severed, and no permanent brain injury occurred. Outcomes the treating surgeons attributed to the brevity of the contact. Both hunters reported long-term psychological effects tied to the specific frequency of elk calls. The brain had formed a direct associative link between that sound and the attack. Both men experienced persistent flashbulb memory, the approach, the impact, and the sensory details of the encounter remaining vivid years afterward. Incident analysis. The primary gear failure was structural. A bow is not a close-range defensive weapon. In a sub-second charge from dense cover, any weapon that requires a multi-second deployment sequence is functionally irrelevant. The compound bow required draw time, anchor time, and aiming time that the encounter never provided. The Glock 20, carried as a sidearm, not as the primary hunting tool, was the only weapon that matched the timeline of the attack. There were no failures in the handgun system. The 10mm performed as expected at close range, delivering enough energy to force disengagement and produce fatal injuries. Practical takeaway. If your primary tool in bear country is a bow, a fishing rod, a camera, or anything that requires more than 1 second to transition into a defensive weapon, it does not exist in a surprise encounter. A sidearm is not a backup. It is your bear defense. The bow is for elk. The handgun is for the thing that heard your elk call and came looking for the source. Sommer's elk call turned him into a beacon, but at least he chose to make noise. In the next encounter, the provocation wasn't a call. It was a companion with 4 legs, no trigger discipline, and a hardwired instinct to run straight back to its owner with a grizzly 2 seconds behind. For years after the Chugach incident, the sound of a dog barking in wooded terrain triggered an immediate cortisol spike and uncontrollable trembling in a man who had survived a grizzly charge. Not the memory of the bear, not the sound of the impact, the bark of a dog. His nervous system had rewritten a hierarchy of threat and placed his own companion at the top. To understand why, we have to go back to a misty August morning in the subalpine thickets of the Chugach Mountains. August 7th, 2014. Air temperature holds at a steady 64 degrees Fahrenheit under a light, misty rain. The moisture traps scent close to the ground, a condition that compresses the sensory environment for both predator and prey. Visibility through the thick willow thickets is limited. Light is diffused and flat, making it difficult to distinguish the brown contours of a bear from surrounding shadow and vegetation. The hiker is moving at roughly 3 miles per hour. His medium-sized dog is off-leash, weaving through the brush ahead of him. The dog transitions from investigative sniffing to a sudden, rigid point. It has caught a scent the hiker cannot yet perceive. In high-density grizzly habitat, that behavioral shift is a data point. The hiker does not yet know what the dog has located, or how close it is. To see why the charge was unavoidable, we have to look at the specific mechanics of what the dog set in motion. The dog detects a grizzly sow at approximately 30 yards and initiates a pursuit, barking aggressively, closing the distance. That action does two things simultaneously. It agitates a sow with cubs, and it removes any possibility of the bear disengaging quietly. The sow countercharges. At that moment, the dog's territorial behavior ends, and its survival instinct takes over. It turns and runs directly back to its owner. This is the boomerang effect. The dog has located the threat, provoked it, and is now leading it at a full gallop back to the one person it identifies as protection. The bear's gait is a low-slung gallop, claws driving into soft tundra for maximum leverage. It is covering ground at approximately 25 miles per hour. The angle of impact is slightly upward. The bear's head strikes the hiker's midsection like a battering ram, transferring the kinetic energy of 500 pounds at speed directly into his skeletal frame. He is thrown backward onto jagged rock and wet moss. The impact produces immediate physiological consequences. The jarring shock to the brachial plexus causes instantaneous loss of grip strength in his right hand. Tunnel vision narrows his visual field to a tight cone centered on the bear. The bear is on top of him. His left thigh sustains a deep puncture wound from the initial bite. Arterial hemorrhage begins. His right hand finds the chest holster. The .357 Magnum is there because it is mounted to his torso, not holstered on his belt, where the impact could have pinned it beneath him or torn it free in the brush. He fires twice into the bear's neck at contact range. The bear sustains a physiological break, pain and shock interrupting the attack cycle, and disengages, fleeing into the brush. Medical findings and aftermath. To understand how close the arterial wound came to determining the outcome, we look to the field treatment record. Immediate care required a high-pressure tourniquet application to the left thigh to control arterial hemorrhage from the puncture wound. Clinical diagnosis at the emergency facility confirmed multiple rib fractures, a grade 3 concussion, and a deep shoulder bite. The medical record notes explicitly that the two contact shots from the .357 Magnum forced disengagement before the shoulder wound progressed to a fatal injury. Without that physiological break, the treating physicians assessed the bite trajectory as life-threatening. Recovery lasted 6 months, dominated by fracture healing and aggressive antibiotic treatment for infection, a standard complication in bear bite wounds due to oral bacterial load. Long-term physical limitations included persistent weakness in the left leg and restricted rotation in the right shoulder from scar tissue formation. The medical findings contain one additional detail worth noting. The dog's pursuit gave the hiker approximately 3 seconds of warning before impact. Those 3 seconds allowed him to place his hand on the grip of his sidearm before the collision occurred. And that returns us to the psychological record, and the reason a dog's bark became the trigger for years of involuntary trembling. The hiker's nervous system had processed the sequence correctly. The dog didn't protect him. The dog manufactured the encounter. His early warning system was the delivery mechanism for the threat. Incident analysis. The controlling error was allowing the dog off-leash in high-density grizzly territory. AmmoLand data indicates dogs are present in 25 to 30% of recorded bear encounters. An untrained dog in that environment functions as a provocation device, agitating the predator and then routing it directly back to its owner. There were no gear failures. The .357 Magnum performed correctly at contact range.
Practical takeaway. A dog in grizzly country is not a defense system. It is a variable you do not control. Off-leash, it will find the threat you were trying to avoid, escalate it from a possible encounter to a guaranteed charge, and deliver it to your position at a full sprint. Leash the dog or leave it at home. And if you see your dog retreating toward you at speed, do not wait to see what's behind it. Draw your sidearm immediately. Whatever is following that dog is, at most, 2 seconds back.
3 encounters, 3 survivors. And in every case, the weapon fired when the trigger was pulled. But what if it didn't? What if the very act of pressing a muzzle against a bear's body, the thing that makes a contact shot lethal, is the thing that disables the gun? The next story exposes a mechanical vulnerability that most handgun owners have never considered. There is a mechanical vulnerability built into nearly every semi-automatic handgun sold in America. It is called out of battery. When you press the muzzle of a semi-automatic against a hard surface, a wall, a body, a bear's skull, the barrel can be pushed rearward into the slide. That rearward movement takes the action out of battery. The firing pin cannot reach the primer. The trigger pulls, and nothing happens. The gun is mechanically incapable of firing at the exact distance where a defensive shot is most likely to occur. 0. A revolver does not have this vulnerability. Its barrel is fixed. Its cylinder rotates independently of muzzle pressure. You can press a revolver against concrete, against a car door, against the neck of a 700-pound grizzly, and it will fire every time you pull the trigger. That distinction is academic until the moment it isn't. On July 14, 2010, on the Kenai Peninsula, it became the only thing that mattered. The dense wilderness of the Kenai Peninsula, Alaska. The weather is overcast, air temperature holding at 58 degrees Fahrenheit. Humidity is high. The light is flat, erasing the shadows that would otherwise betray movement in heavy cover. The hiker is navigating a narrow game trail, attention divided between footing and forward visibility, roots, slick mud, and the constant compression of undergrowth against his rain jacket. The only sounds are boot strikes on soft ground and the brush of fabric against alder branches. This is the sensory environment of a blind corner encounter. Not a wide drainage or an open ridgeline. A tight, walled game trail where what is around the next turn is invisible until you are already there. The hiker rounds a bend in the alder thicket and is suddenly less than 15 feet from a brown bear. There is no interval, no time for a bluff charge, no vocal warning from the bear, no opportunity to back away or deploy deterrent. The bear initiates a high-velocity surge immediately, driving off its rear haunches in a low, explosive gait that closes 15 feet in under 1 second. The physics of the collision. The bear's skull strikes the hiker's chest at a 30-degree upward angle, lifting his 190-pound frame off the ground. He lands on hard-packed glacial silt. No give, no absorption. The norepinephrine surge that follows produces immediate loss of fine motor control. The bear pins his legs and bites at the shoulder. The pressure of 700 pounds concentrated on the hiker's lower body causes rapid peripheral vision loss and localized numbness in the limbs. His hand finds the .44 Magnum in his chest holster. He does not attempt to create distance or establish a sight picture. He presses the muzzle directly into the thick fur of the bear's neck and pulls the trigger. And because the weapon is a revolver, it fires. No slide to push out of battery. No barrel to shift rearward. The fixed action discharges regardless of the pressure against the muzzle. The .44 Magnum round, along with the expanding gas of the muzzle blast, delivers directly into soft tissue at contact range. The bear's spinal cord is severed. The attack stops instantly. Medical findings and aftermath. To understand what the contact shot prevented, we look to the clinical record. Immediate field treatment focused on stabilizing massive crushing injuries to the left shoulder and puncture wounds to the lower extremities. Clinical diagnosis confirmed the .44 Magnum round had severed the bear's spinal cord, producing an immediate physiological stop. The hiker avoided arterial hemorrhage because the bear disengaged the instant the shot fired, the concussive force of the expanding gases driving it back before a sustained bite sequence could begin. Recovery involved several weeks of wound debridement and surgical repair to the shoulder. Long-term physical limitations included reduced overhead range of motion and persistent cold weather pain in the shoulder joint. The hiker returned to backcountry activity within 4 months, a recovery timeline directly attributable to the brevity of the mauling. The psychological record follows a pattern documented in blind corner survivors: persistent anxiety on narrow trails, compulsive scanning of brush lines, and a refusal to hike without deliberate noise-making. The nervous system's attempt to prevent another zero-warning encounter by ensuring no animal within earshot is unaware of the hiker's approach. Incident analysis. The encounter validated 2 equipment decisions simultaneously. The chest holster kept the weapon accessible during a ground fight, and the revolver fired at contact distance, where a semi-automatic may not have. There were no errors in the defender's response, no gear failures, no delayed reactions. This is one of the cleanest defensive encounters in the database, and the mechanical reason it succeeded is the fixed action of the revolver. Practical takeaway. At contact distance, a semi-automatic has a vulnerability a revolver does not. If your bear defense plan involves pressing a muzzle against a bear's body, and in a ground fight it will, the mechanical action of your weapon matters as much as the caliber stamped on the barrel. A gun that cannot fire at 0 distance is not a defensive weapon. It is a liability with a price tag. Understand what out of battery means and make your equipment choice accordingly. A revolver that can't jam. A chest holster that survives the chaos. By now, the pattern is clear. Or so you'd think. The next survivor had the right caliber. He had training. He had every reason to believe he was prepared. But he made one equipment choice that turned a survivable encounter into 4.2 seconds of bleeding out while his gun sat pinned beneath. A black bear lies on a gravel trail, its snout 2 feet from a hiker's boots. Spent brass from a 5-shot snub-nose .38 special revolver is scattered in the dry pine needles nearby. The hiker is uninjured. The bear is dead from a facial shot that disrupted its central nervous system. The ballistic weight of the cartridge that stopped it sits near the bottom of every published bear defense recommendation list. Late June 2018. The dense timber of the Blue Mountain region. Air temperature holds at 78 Fahrenheit degrees. The trail is a narrow corridor pressed between a rock face and a steep drop-off, the kind of topographic choke point that predators use instinctively, moving through it to minimize caloric output while hunting. The air carries the scent of damp earth and rotting leaf litter. The only sounds are the rhythmic strike of hiking poles and the occasional chatter of gray squirrels. A solo hiker is moving through this funnel at roughly 3 miles per hour. On his person is a standard 5-shot revolver loaded with 158-grain hard-cast lead bullets, a non-expanding projectile designed to maintain shape on contact and push through dense tissue rather than dumping energy at the surface. His bear spray is mounted on a pack strap. In the terrain he is moving through, that positioning will become relevant within minutes. To see why the terrain eliminated every option except the one the hiker used, we have to look at the geometry of the funnel. The V-shaped corridor removes lateral movement. There is no stepping off the trail, no breaking to the side. The rock face is on one edge, the drop-off on the other. Whatever comes down this trail toward the hiker has a straight, unobstructed approach.
and so does the hiker's line of retreat. The first sensory signal is not visual. It is a rhythmic thud, the vibration of heavy paws on soft forest floor. Within 20 feet, a black bear weighing approximately 300 pounds detaches from the alder brush. Its ears are pinned back, head low, eyes fixed on the hiker's midsection. There is no huffing, no ground swatting, no bluff sequence. This is a predatory approach from an animal that has made a decision. The closing speed is estimated at 35 feet per second. At that rate, 20 feet of distance represents well under 1 second of available response time. The hiker cannot reach the bear spray on his pack strap. Tunnel vision narrows his visual field to the bear's chest. Adrenaline load produces a temporary loss of fine motor control. His hands are shaking when he draws the revolver. At less than 10 feet, he fires the first round. The 158-grain hard-cast bullet strikes the upper neck. There is no knockback. That is a cinematic artifact, not a physical reality. What the impact produces is localized pain, muzzle flash, and percussive noise at close range. The bear's forward momentum falters as its nervous system processes the input. That hesitation is the window. He fires twice more in rapid succession. The second round misses, carrying into the timber. The third enters the bear's facial structure near the snout. The animal collapses and skids on the gravel, stopping 2 feet from the hiker's boots. The revolver's hammer rests on a spent casing. The 5-shot cylinder is effectively empty.
Medical findings and aftermath. To understand what the hard-cast ammunition accomplished, we looked to the ballistic analysis. Post-incident examination confirmed the bear was a healthy male with no signs of disease or starvation. The attack was predatory in intent. Ballistic analysis showed the 158-grain hard-cast rounds achieved 12 inches of penetration, a result hollow point ammunition would not have produced. Standard defensive hollow points expand on contact and exhaust their energy in the first few inches of subcutaneous fat, stopping before reaching organs or skeletal structure. The non-expanding rounds maintained their shape and continued. The facial shot disrupted the central nervous system, producing immediate loss of motor control and respiratory failure. The hiker sustained no physical injuries. His heart rate remained elevated for over 60 minutes post-encounter, and he reported a rubbery sensation in his legs, consistent with post-adrenal crash. In the weeks following, he developed significant avoidance behavior around blind corners on trails and transitioned his carry method from a pack strap to a chest rig for faster access. He retained the .38 special, but moved to a heavier hardcast load to increase his penetration baseline. Incident analysis. The primary error was entering a high-density predator corridor without a noise-making protocol. Audible presence allows bears to move off before visual contact is established. The miss on the second shot illustrates the accuracy cost of a short-barreled revolver under extreme physiological stress. The snub-nose's short sight radius compounds the fine motor disruption that adrenaline load produces. The effective actions were ammunition selection and sustained fire. Hard-cast bullets reached vital tissue where hollow points would not have. Firing until the bear collapsed prevented a mauling that a single deterrent shot might not have stopped against a committed predatory animal. Practical takeaway. This encounter does not recommend the .38 special for bear country. It documents what the .38 special can do when loaded correctly and fired accurately under pressure. Hardcast, or FMJ ammunition, is non-negotiable in any small caliber defensive load against bears. Train until you can place 5 rounds into a 10-inch target at 10 feet under stress.
A .38 in a chest rig with hard-cast loads and a steady hand is a viable defensive tool. The same gun with hollow points and a pack strap holster is a significant liability.
He fires the .25 ACP into the bear's face. The round penetrates less than 2 inches, and somehow, impossibly, the bear stops. To understand how a vest pocket pistol stopped a 600-pound grizzly, we have to rewind to the minutes before the trigger was pulled. May 12th, the Alaskan interior. Heavy, low-lying fog holds the early morning in absolute stillness. Air temperature sits at 49 degrees Fahrenheit. Light is gray and non-directional, collapsing depth perception and flattening the visual field into a uniform wall of brush and muted shadow. The hiker is moving through a willow stand, his trekking poles generating a rhythmic metallic clicking against the rocks beneath the fog layer. On his person is a vest pocket pistol chambered in .25 ACP. It is not his bear gun. It is a secondary tool carried for smaller threats. A compact, light, easily forgotten piece of hardware that most bear defense guides would not list as a viable option against a large predator. He is moving downwind. His scent is carrying away from him, away from the depression in the brush 20 feet ahead where a bear is browsing. Neither of them knows the other is there. To see why there was no warning and no interval, we have to look at the wind direction and the proximity at first detection. The bear detects the hiker at close range with no advance scent information. It does not huff. It does not bluff. It initiates a high-velocity charge from 20 feet, a bounding, low-profile gait that minimizes silhouette while pushing its speed to roughly 30 miles per hour. At that pace, 20 feet closes in well under 1 second. The bear's head strikes the hiker's thigh at a 45-degree angle, shifting his center of gravity and throwing him onto sharp, fractured granite. The impact produces an instantaneous adrenal response. Blood pressure spikes, fine motor control degrades. The bear's jaws close on his forearm. The crushing pressure produces partial grip failure in that hand. Retrieving any weapon from any position is now a task requiring deliberate effort against a body that is actively losing fine motor function. He draws the .25 ACP. In the struggle, he fires several rounds into the bear's face and neck. To understand why this works, we have to look at what the .25 ACP is actually doing in this encounter. It is not producing a mechanical stop. The cartridge lacks the sectional density to penetrate a grizzly's skull or reach organs through heavy muscle and fat. What it produces is sharp, localized pain at close range, combined with concussive muzzle blast occurring within the bear's immediate sensory space. The bear's internal calculation shifts. The prey has become an unpredictable source of pain and noise. The bear breaks contact within 5 seconds of the first shot and retreats. It is not physically incapacitated. It has decided the cost of continuing is too high. Medical findings and aftermath.
To see what the small caliber rounds actually accomplished at the tissue level, we look to the clinical record. Immediate field treatment addressed deep lacerations and crushing injuries to the forearm and upper thigh. Clinical diagnosis confirmed the .25 ACP rounds had penetrated only a few inches into muscle and fat, insufficient depth by any standard bear defense metric. However, the rounds had struck sensitive tissue near the eyes and snout, producing the pain response that drove disengagement. The hiker sustained no arterial hemorrhage. The bear left the scene within 5 seconds of the first shot. Recovery involved multiple antibiotic courses to manage the high bacterial load present in bear saliva, alongside physical therapy to restore sensation in damaged nerve pathways of the arm. Long-term physical limitations were minimal, localized numbness and significant scarring. The clinical data is consistent with a mauling that was interrupted before it progressed to a sustained consumption pattern. The psychological record documents a specific response profile: profound equipment inadequacy. For years following the incident, the survivor reported a compulsive need to carry heavy-caliber firearms, a neurological overcompensation driven by the recognition that his survival had depended on a weapon with almost no mechanical margin for error. His nervous system had processed the encounter correctly. He had won on the thinnest possible terms. Incident analysis. The primary error was caliber scaling. The .25 ACP is engineered for thin-skinned targets at close range. It has no design basis for stopping large predators through physiological shutdown. It worked here through a pain and noise deterrent rather than a mechanical stop. That distinction matters because a deterrent depends entirely on the bear's willingness to disengage. A bear in a deeper predatory state may not make the same calculation. The effective action was refusing to stop firing. Despite grip failure and active mauling, the hiker kept the weapon in his hand and continued to fire until the bear's behavior changed. That persistence, not the caliber, was the controlling variable. Practical takeaway. The .25 ACP appears in the survival database. That does not make it a bear gun. It stops attacks by changing the bear's mind, not by shutting down its body. If you carry a small caliber, understand exactly what you are relying on. Not stopping power, but pain threshold. And pain threshold varies by animal, by state of aggression, and by how committed the predator is to finishing what it started. Train to fire accurately under grip failure, and carry something bigger the next time you walk into the Alaskan interior.
6 encounters, 6 survivors, and not one of them was saved by caliber alone. The tent breach survivor lived because his weapon was strapped to his chest, not stored in a boot. The bow hunter lived because he carried a sidearm he hoped he'd never need. The dog owner lived because 3 seconds of warning gave him enough time to find a grip. The Kenai hiker lived because a revolver doesn't care if the muzzle is pressed against flesh. The backpacker lived because he refused to stop fighting for a gun his own gear was hiding from him. And the man with the .25 ACP lived because pain, not ballistics, changed a bear's mind. The pattern isn't about what gun you carry. It's about whether you can reach it in the first 2 seconds of the worst moment of your life. That's the variable that separates the survivors in this video from the people who don't appear in any database at all. Carry it on your body. Carry it where your hands can find it when your vision is tunneling and your grip is failing. And understand that the fight is decided before the trigger is pulled, in the geometry of where you placed the weapon, and how many layers of gear stand between your hand and the grip. If you've loved these terrifying true stories so far, we need your help to keep sharing them and create new episodes every week. Please grab your phone, scan the QR code now, and tap the subscribe button that opens on your screen.